and welcome to Wellness Live. My name is Dr. Olivia Moses, and this broadcast is brought to you by Loma Linda University Health's Department of Risk Management's Living Whole Wellness Program. Well, we are so excited that you've joined us today, and we have a very important topic that we're going to be discussing. As you know, and as you can see, we are not in our regular studio. We are in our remote studios or our home because of COVID-19. And due to COVID-19, we've had to make a lot of changes. And I think you have too over the last few months. You've seen COVID change our daily routines, and you have seen it change kind of how we take care of our health and our health. Now, what we are also seeing because of COVID-19 is there are a lot of different other concerns that have come up that COVID has maybe made worse. And so today I am so excited to introduce to you one of our wonderful physicians here at Loma Linda. She is the Chief of Forensic Pediatrics. Her name is Dr. Amy Young, and she does amazing, amazing work. And she's going to talk to us a little bit about what she is doing in the Resiliency Institute for Child Adversity. And because of COVID, we are actually seeing incidents of child abuse going up. And because of her work and her team's work, Loma Linda is doing some amazing things in helping combat this very important issue. So I'd like to introduce you, without further ado, to Dr. Amy Young.
Hi, Dr. Moses. Thank you so much for having me. It is kind of odd in this time to shift to Zoom presentations, so I will do my best to really get the information out to the listeners. The Resiliency Institute for Childhood Adversity is, I believe, still the newest institute at Loma Linda. We are the 13th health institutes. Most people are used to more common institutes, Cancer Institute, the Heart Institute, but this really is talking about very mission-driven work at Loma Linda and the service that we provide to abused and neglected children throughout both San Bernardino County, Riverside County, and beyond. The Resiliency Institute is my passion, but I think to really explain the scope of that work, I need to start really kind of at the beginning of what Loma Linda has done in the years prior to our institute and how that has led us to this next area. So I am going to share my screen so the viewers can see the PowerPoint. Like I said, or Dr. Moses, you mentioned, I am the Division Chief of Forensic Pediatrics at Loma Linda. I'm also the medical director of our Outpatient Child Advocacy Center, which is really where the work began. I'm in my 16th year now of evaluating and treating children who are the victims of child abuse and neglect. I serve as an expert in our county, and as you mentioned, this is really a timely discussion because although COVID has caused a decrease in the number of child abuse cases reported to the child abuse hotline, which is happening because children are not out in the community and they're not in their schools. Teachers are the #1 reporter of child abuse. We've seen a decrease in the number of reports, however, an increase in the incidence of severe cases of child abuse. So our hospital admissions have drastically increased with COVID. To tell you what a forensic pediatrician is, the American Board of Pediatrics recognizes our group as a group called Child Abuse Pediatricians. We are responsible for the diagnosis and treatment of infants, children, and adolescents who are suspected victims of any form of maltreatment. When trying to understand what does child maltreatment encompass, that really is a wide gamut of things that can happen to children that are traumatic in childhood. Physical abuse, sexual abuse, medical child abuse, which is either causing factitious illness in a child or not getting children the necessary medical treatment, neglect, which can include starvation and severe malnutrition, and psychological and emotional abuse. This was really a grim realization for me as a medical student. I grew up in a relatively low income area. My own extended family story did include poverty and domestic violence, but I can really honestly say that it wasn't until I did medical school at Loma Linda and on rotations learned that children suffered such severe injuries that they were hospitalized. This is particularly true for children under 5 who are nonverbal and are really the most vulnerable victims that we see. And it's such a terrible time for trauma to happen when there are such terrible consequences for a developing mind and spirit. To become a child abuse pediatrician, you must complete a 3-year residency in pediatrics and become board certified. Then you take part in a fellowship. All of this fellowships in pediatrics are 3 years. There is a 3-year fellowship, and we have one of the few recognized fellowships in the nation in child abuse at Loma Linda. And it is an area of extreme workforce shortage. There are only approximately 350 board certified physicians in the nation in this area, and approximately half of them are nearing retirement age. So it's an area where we definitely need more professionals to join us. When we look at the burden of child maltreatment in the area where we live, it is a major cause of child death and disability. Approximately 5 to 6 children die at the hands of their caregivers every day in our nation. There are roughly 2,000 deaths per year, but a very high incidence of death in San Bernardino County. So just in our hospital alone, we see about 15 homicides a year. Those are usually very young infants who have suffered severe head injury is probably the number one reason that it results in a fatal injury. There are over 120,000 children reported to CPS in both Riverside County and San Bernardino County each year. Sexual abuse affects approximately 1 in 5 females and 1 in 7 males, but we believe that the actual incidence of child abuse could be as high as 3 times greater than what is actually reported. Neglect is by far the most common form of abuse. Sexual abuse is the second most common. And the hardest to detect actually is emotional abuse. It is also the most difficult to protect children from, yet has very damaging long-term mental health effects. We'll look at our team at Loma Linda. We have a team of 3 physicians and 3 forensic nurse practitioners, and also a forensic nurse. We conduct about 300 inpatient consultations per year in our hospital. Those encompass everything from abuse of head trauma, fractures, skin injuries, which includes burns and bruises, abdominal trauma, poisonings, some of which are intentional poisonings, and failure to thrive, which often when we're involved is a scenario in which a caregiver is withholding food from a child. We see of those cases, about 100 of them involve abuse of head trauma. And one of the sad realizations we have found is that when you look at a study that was conducted at Brown University, they looked at approximately 200 children and found that 31% of those children suffered abuse of head trauma that was missed by a physician prior to the correct diagnosis. It took anywhere from 7 days to as long as 189 days to get the correct diagnosis, and a large portion of those children suffered a second injury in the meantime. What the study found was that with this retrospective chart review, it was believed that 4 of 5 deaths might have been prevented if physicians were better at recognizing the signs and symptoms of child abuse. As I said, there's about 15 homicides per year in our hospital, and about 2,000 outpatient cases that we conduct of child abuse. So if a child has suffered an injury that is so severe that they're hospitalized, then we conduct that consultation in the hospital. If they are not hospitalized, we see them in our outpatient clinic setting, which we're going to talk about. This just gives you a little bit of the geography. I'll try to use my pointer here. Loma Linda is very unique in that it is the only level 1 trauma center for the largest geographic area in the nation. And what that means is children who've suffered severe abuse are often airlifted and end up in our hospital. So we are the only child abuse services in all of San Bernardino County, and we take care of all of the children in San Bernardino, Children are brought to us from Mono, Inyo, Kern, parts of LA County, and also Riverside children are often, if they need subspecialty care for trauma, they would be transferred to Loma Linda also. So our team handles a very large burden of abuse compared to other similar facilities. I feel like it's easiest to tell you what we do if I really give you a case example. This is a young infant who presented at an outside hospital with leg swelling. The image that you see to your left is the first image that was obtained. So the baby presented with, they were not moving their leg, they had leg swelling, but the caregivers did not provide any history of trauma. They didn't know of anything that could account for the swelling in the baby's leg. The physicians conducted an x-ray which revealed a fracture, and that's the image that we see on the left. This is a fracture, a displaced fracture of the diaphysis of the femur, which is the large bone of your upper thigh. Once confronted with this, one of the caregivers reported that in fact it was possible that they may have, when they left the baby on the bed for a diaper change, lost track of where they laid the baby, and maybe they may have sat on the baby. The caregiver was very emotional and upset, and the physician felt like maybe this was a possible explanation. Caregiver's very large, the baby's very small, maybe this explains the injury. However, while they were ready to discharge the baby, they did decide to make a report to Children and Family Services. Luckily, the social worker who responded had been trained by our team at Loma Linda and called the team at Loma Linda for a consult. I asked for an additional x-ray to be taken, which is the x-ray on the right, which shows displacement. The vertex of this fracture is anteriorly or towards the front of the baby. This would not make sense with the mechanism that was given by the caregiver. If someone had sat on the baby, right, we would expect that this displacement would be posterior and not anterior. This was our first clue that the history was false. We also know that in babies like this, a much bigger workup must be done. We have to x-ray all of the bones in their body and look at their head at a minimum of CT scan. And so we asked that the baby be transferred to Loma Linda for this additional workup and not discharged. When the baby arrived at our facility, we found other injuries that were consistent with child abuse, including injuries in the baby's mouth. And on further imaging, found additional fractures that a doctor couldn't necessarily see just by looking at the baby, and a head injury, evidence of a prior bleed in the baby's head. This really, this case really kind of shows us, often people will ask me, what types of person do this, right? Why would somebody do this to a baby? And what I've learned in my 16 years is there is no specific type of person who commits child abuse. I've seen people from all walks of life, pastors, teachers, doctors, law enforcement officers. You cannot detect a child abuser by their appearance. And also I would say that people are not all good or all bad, right? We want to say, well, if you've committed abuse, you're in this bad category of person. But there are people who don't have the ability to handle the frustrations or the stresses and in split second cause injury that changes a baby's life forever. The thing that we look for, however, is insight. Someone who can take responsibility so that they can receive services to hopefully prevent these types of things in the future. When you look at how we respond to child abuse, in the days before advocacy centers, which Loma Linda provides the medical services at our San Bernardino County Advocacy Center, children would receive multiple interviews and examinations. So they would tell someone at school, they would need to tell a police officer, they would need to tell a hospital, they would need to then tell, physicians who had special training in child abuse, a child protection worker, a lawyer. It was really this long cycle where children would have to tell their story many times. Now we work in an advocacy center where everything is done really under one roof for the child. So in San Bernardino, this is called the Children's Assessment Center. It is a public-private partnership in San Bernardino County with Loma Linda University and multiple other partners in the county. And in this location, children can come and have a child-friendly atmosphere and receive all of the services that they need in one location. We partner with the Department of Behavioral Health, Children and Family Services, the District Attorney's Office, Sheriff's Department, Children's Network, First Five, and Children's Fund, which is a nonprofit, and all of the local police departments. Here we give competent and quality child abuse medical assessments. We conduct forensic interviews with specially trained forensic interviewers, provide treatment and mental health referrals, and reduce the number of times children are subjected to interviews or medical exams. And we can then coordinate that in one multidisciplinary setting that makes sure that the investigators have all of the information that we need. We also have victims advocacy services on site, which is provided by the District Attorney's Office, and mental health treatment and assessments for children. It's a very beautiful setting. I thought I would share just a couple pictures. Often you know that programs like this are underfunded, but we have so much support from the Children's Hospital and the faculty practice group and individuals in the county that we've made a very beautiful place for children. So this is the playroom, and we have a therapy dog in our playroom, Mac. We have a garden setting for children that's really inviting. Our exam rooms are really state-of-the-art with all of the special equipment that we need for photography and forensic evaluations. Very warm and welcoming forensic interview rooms where social workers who don't look like police officers can talk to children and audio and video record the forensic interviews. And then also just a special kitchen for children, because they do spend so much time there during an investigation, that we can feed them, send them out with needed items. Children love, stuffed animals and things, so we have all of that on site. So that's a little tour of the center, and I thought this would maybe be a good chance for some questions, Dr. Moses.
Thank you, Dr. Young. What important and amazing work that you do. We have a lot of questions coming through, so just want to remind our viewers, if you are watching us live and you have questions for Dr. Young, go ahead and type them in the comments section if you're watching on YouTube or if you're watching on our employee website. So why don't we get straight to it? Our first two questions actually come together, but I'm going to ask them one at a time. The first one is, what are the most common behaviors that may indicate maltreatment?
So children typically, maltreatment can cause a lot of anger. So children tend to act out emotionally, act out behaviorally, and this gets misdiagnosed or mislabeled. And so I think children who are either very withdrawn or are displaying a lot of anger, those are concerns. Definitely in child sexual abuse, there can be sexualized behaviors because children have been exposed to, either inappropriate material or inappropriate touching, which causes children to act out. But don't expect children to come running and say, "Help me, somebody hurt me." Usually abuse happens at the hands of someone they love and they trust, and they are not very ready to tell. Most abuse is a delayed disclosure, so it's important to look for behaviors.
The question that kind of goes along with this is, what are any signs or symptoms of child abuse and neglect that maybe the layperson can see?
So in addition to those kind of behavioral indicators, looking for things, children bruise in very typical locations, right? Accidental bruises tend to be the forehead, the chin, the palms of your hands when you fall, or your elbows or knees or shins, bony prominences of the body. When children develop bruises in places like their cheeks or their neck, their chest or abdomen or upper thighs, those are atypical locations for abuse. Same with the inner upper arms. Those can be grab marks. Anything that seems to have a pattern. Slap marks can leave lines in a row. Belts and cords can leave loop marks. Also understanding though that you can't typically see their whole body. So if you see something, head, neck, arms, legs, and you're concerned about it, report it.
We have another question here is, what is the source for good child discipline techniques that take into account all of the new psychological data we have learned?
Well, so I've been a parent for 20 years, and I will say that what I know came from my experience much more than my learning. Children need to be seen as our gift to help through this lifetime. Parents often falsely see them as an extension of themselves. If they misbehave, I'm a bad parent. If they don't do what's asked, that reflects poorly on me. And it's really separating yourself from feeling responsible for all of your children's actions. They're developing, they're exploring the world, negative things are normal. And then the other thing is to realize that we have to get on their level. We need to get down, make eye contact with them, hear their emotions, reflect their emotions back to them and tell them that we hear them, we see them, we understand it's important to them. What's important to you or I is not necessarily what's important to a 5-year-old. If they want a cookie, they want a cookie, right? Get on their level, make eye contact, hear them, and let them, just like we want to feel valued, they want to feel valued. It's all about connection.
Okay, we also have another question regarding the Advocacy Center. So does the Advocacy Center provide any prevention services for reducing the threat of child abuse?
We do, and that is actually, so we do have a Shaken Baby Prevention Program. We work with the County Prevention Group, and we're involved in several grants with prevention work, and it is something that we're expanding in our new institute.
So for those of our viewers who don't know what shaken baby is, maybe describe that a little bit.
Yes, so shaken baby syndrome is really the lay terminology. In medical, we call it abusive head trauma. It is typically, when you think of shaken baby, however, a caregiver who has gotten frustrated holds the baby typically around the arms or under the arms and shakes the baby back and forth in frustration. This causes the head to move back and forth. There are rapid accelerations and decelerations, and that causes injury to both the blood vessels around the brain and the brain tissue itself, and can cause a variety of findings, typically hemorrhage in the head, injury to the brain, and hemorrhages in the back of the eye. And then it can lead to the baby being unconscious or not breathing.
Okay, so we have one more that we will ask for now. They keep coming. Okay. Is how can I learn more about becoming a foster or adoptive parent? And I think they're asking probably specifically for children who've gone through abuse.
So, there are many websites where you can look. You can call the county. The county has a process where they can refer you to a foster family agency. There is also something called Foster More. It's an organization that will help you find the right connection to become a foster parent. I was a foster parent myself and then became an adoptive parent. It is a great need. So I would really urge anybody to check with their county or Foster More. Those are two good places to start. Another agency is called Seneca. It's another one that I have come to really appreciate. And those are all good places to start the process.
Okay, well, thank you so much, Dr. Young. These questions have been fantastic. So to our viewers, keep them coming while we have Dr. Young with us. So why don't we get to the second half of your presentation?
Okay, I will share screen again here. I think that is working. Okay, so we are gonna jump ahead a little bit. I did tell you about our therapy dog. Mac is named after Jeremiah McKay, a detective who was killed in the line of duty. He was a child abuse detective and worked a lot of cases with us. And we named this dog after him since sheepdogs are protectors of the flock. Therapy animals are known to lower stress hormones, raise oxytocin and dopamine. This helps a lot of children get through both their forensic interviews and their medical exams. He has continued to come. He's now 6 years old, and every child leaves with a stuffed Mac dog. So let's talk a little bit about the foster care crisis, since we had some questions about becoming a foster parent. There are 2.2 million children in San Bernardino County. There are about 60,000 children reported. There are 8,000 children in foster care at any given time, and about 5,000 of those are in out-of-home care. In any given year, 2,500 children are removed. Imagine being taken from your home as a child without being able to understand or much explanation and being placed into a stranger's home. This is a definite traumatic experience for children. Foster youth and education, their outcomes are abysmal. Children who enter into the foster care system, less than 50% of them will graduate from high school, less than 3% will go on to higher education, and less than 1% will graduate from college. Upon exiting foster care as a young adult, 50% of children will be homeless. So, why is that? Why are those outcomes like that? For one, it's the lack of nurturing homes for children. We need more nurturing foster homes. Another problem is the effects of trauma on children. So Dr. Folletti did a study in the 90s and looked at 10 different childhood traumas and gave scores to people. So they looked at things like the list on the left there, physical abuse, verbal abuse, sexual abuse, and they added these scores up. And what they found is, as children experienced 4 or higher of these adverse childhood experiences, it led to very poor health outcomes as adults. Alcoholism, drug abuse, depression, suicidal attempts, ischemic heart disease, cancer, a lot of chronic medical conditions. What we now know is that adverse childhood experiences are actually probably the #1 public health threat in our nation. As physicians, we learn how to treat hypertension, obesity, healthy eating, but we don't always get down to the roots of these issues, which are in childhood trauma. And it isn't as easy as saying, well, if you experience sexual abuse as a child, you engage in more risky behaviors as an adult, and then you contract, these conditions. It's not just that people make poor health choices. We actually know that our DNA is our genetic makeup. It's our code, right? It's a way to kind of explain it is it's written in permanent marker. That is your code. But how it is expressed is more like something written in pencil. And your environment and your experiences change how your DNA is expressed. And we know that trauma can put chemical markers on our DNA that cause certain genes to be turned on and turned off. If that gene was a cancer surveillance protein, now that places that person at increased risk for cancer, but they may never have been a smoker. They may have ate well, but the untreated trauma as a child put them at greater risk. So really that led to the Institute. It is not enough to be a physician who comes in, diagnoses child abuse, treats it, and then never sees the child again, which is really what we have done thus far because there's so many children who are suffering. But what we want to do now is expand what we're offering to them. So we are now undertaking initiatives under the Resiliency Institute to recruit foster families. We actually did an event at Loma and it brought in 10 foster families, which is a huge number for one institution. We will continue our work at the Children's Assessment Center. However, we are opening a new clinic called the Resiliency Clinic. There are 8 exam rooms there, and that will allow us to provide ongoing trauma-informed well child care to children who have experienced child abuse and neglect. This also gives us the ability to continue to watch children and be sure that they aren't experiencing additional abuse. In the days before the Institute, the only time I would often see a child back is if they suffered a second incidence of abuse and I was consulting. This is to avoid that. This is to be involved in their lives on a more regular basis and be sure that we are getting the best outcomes for them. We also have a scholarship program within our Resiliency Institute, and we have currently about 80 children in that program. We have assigned them mentors. They're being mentored from 9th to 12th grade, and they're given a scholarship to one of 3 of our partnering schools. We currently have our first student as a junior, and soon we hope to stand at her graduation. And she is a young woman who I treated as a child. And back before, I wouldn't have much to offer her. But now with the Resiliency Institute, we have something where we can actually see that we've changed the trajectory of their lives in the long term and hopefully have led to better health outcomes. This is just a little imagery of the Institute. It is not open yet. Leaning on Rhonda Spencer and some research at Loma Linda, looking at factors that promote resiliency. One of them is a connection to nature. So our clinic has a theme of nature throughout, and we hope to be opening this by the end of the year. So now we can finish up with the rest of our questions.
The Institute looks amazing.
Thank you.
Okay, so this actually comes from a psychiatrist. They ask, any tips for psychiatrists in ensuring that abuse doesn't go undiscovered? And what can we do to reduce their ACE score when we discharge them back to their parents, schools, and neighborhoods where they become re-traumatized?
Oh, this is such a good question. I think my first message to a psychiatrist would be, when you are evaluating a child who suffered abuse, make sure you get the history from the child, and make sure you make your diagnoses based on, exhibiting symptoms in the child. What I have found is that children who suffer abuse and are in the foster care system, they get a lot of reports of bad behaviors, and they're diagnosed with conditions like oppositional defiant disorder, but it's all at the word of the caregiver, right? And not at the word of talking to the child. And so we see a lot of post-traumatic stress disorder in children misdiagnosed as other mental health illnesses based on a caregiver's report. ADHD, things that then are over-medicated. I would also recommend that you learn signs and symptoms of abuse. What types of bruises, it's very easy information to find, pattern bruises and locations of bruises. And when you are seeing a child, if they have experienced abuse before, they are at a risk of increased abuse. A lot of that can be because of those behaviors. So get a look at their whole entire body and talk to them alone.
Excellent. So we have another question, this time from a parent. How can I prevent adverse childhood experiences in my own children?
I think this is the goal of a parent, right? How do I nurture my child and make sure that they have experiences that lead to resiliency? I think that you have to be very careful who takes care of your child, who you invite into your child's life. A lot of times I meet people, a lot of abuse happens at the hands of an unrelated caregiver, like a boyfriend to a mother. And it isn't the same connection, right? And mothers will tell me, well, I don't trust him with my car, or I don't trust him with money, but I leave my children with him. You need to be sure that the people in your children's lives have the same values that you have for your children. And then I think also spending quality time where you connect with them so that they feel like you're someone that they can tell things to and not get in trouble, not disappoint you. That's a ground rule in my family. If my children were to drink alcohol, they have to be able to feel that they can come and tell me and I'm not going to be mad. I need to know what's going on in their lives. So set ground rules of respect and love and nurturing. And, honestly, it comes down to, how do you want to be treated in a relationship? That's what you need to foster in your children.
Well, thank you so much, Dr. Young. We just want to wish you many blessings on the important work that you do. And thank you so much for giving your precious time to us here today. Before we leave, I would love for you to share again the information for the Advocacy Center and your and the Institute in case any of our viewers want more information.
Yeah, so I think the easiest way to get information would be to email me, which is an easy email to remember. I'm Dr. Young. I only take care of young children, and my email is ayoung@llu.edu. And you can reach out to me by email, and oftentimes people will say, what could I do? How can I help? We have so many ways that people can contribute from all walks of life. We love to hear from people that want to contribute to kind of express more love to these children.
Okay, well, thank you so much again, and I want to thank each of you for joining us for Wellness Live. If this is your first Wellness Live session, we hold Wellness Live pretty much every month on the last day of the month. It's only November and December that we don't do it on the last, Wednesday of the month. And to remember that, we say Wellness Wednesdays, we have Wellness Live. So that's the last Wednesday of the month. Again, I want to thank Dr. Young for being here, and thank you, and we will see you next time.
Thank you, Dr. Moses.